This week on Jersey Matters, hospitals in New Jersey are preparing for the arrival of the Omicron variant of COVID-19. We'll talk with Dr. Shareef Elnahal, CEO of University Hospital. New Jersey is going to get billions from the federal infrastructure bill. Congressman Donald Payne tells us how it's going to be spent. And could State Senator Loretta Weinberg become governor for a few hours before she retires at the end of the year? We'll explain how that might very well just happen. Hello and welcome to Jersey Matters. I'm Larry Menti. Let's get right to Dr. Shareef Elnahal, President and CEO of University Hospital in Newark. Doctor, as always, thanks for joining us. I know you've been busy over there. Everybody's reacting to a new variant of the coronavirus, the Omicron variant. How is your hospital getting ready for this?
It's a big concern, Larry. The number of mutations on the part of the virus that really does the action of getting into human cells and infecting you, it's called the spike protein. Just for some context, the Delta variant, which is the one we're dealing with now, the worst we've seen so far in the US, has about 10 mutations in the spike protein. The Omicron variant has over 30. And so the fact that it looks so different from the original virus, which were designed against the vaccines that were developed, the fact that it looks so different is what people are concerned about. And when you talk about a virus that can continue to spread in fully vaccinated people, potentially even boosted people, that concerns all of us. So we're re-upping our surge plan here. We're making sure it makes sense in light of new challenges when it comes to staffing. And we're also clearly defining the criteria by which we start shutting down other services if needed to deal with a surge of patients should we face that. So all that's happening in real time. I think every hospital in the country is looking at their surge plan again in anticipation of what might happen here.
Yeah, I've heard that a lot about the 32 or 30 plus mutations in the spike. And I haven't heard a real explanation of why that is so concerning. Does that mean it can change so that it becomes it's resistant to a vaccine?
Looking at this pretty simply, your antibodies are trained from the vaccine to look for a virus with a particular appearance, with a particular number and character of proteins and amino acids. And if the virus ends up mutating to a point where it looks a lot different, then the antibodies you have and the cell-mediated immunity that you have is just not going to recognize it. It will allow the virus to replicate and make you more sick. So that's what the concern is. We don't know the answer to the very important questions here. Whether this spreads more easily than Delta, whether it causes more severe disease, and of course, whether our vaccines will work to protect against it. All of that's being done by hard work and scientists all over the world.
Yeah, and I realize this could change dramatically in a day. And so I want to point out that we're videotaping this on a Tuesday. And because right now there are no cases in New Jersey, right?
No cases in New Jersey and no confirmed cases yet in the United States, which is good news. However, Canada does have reported cases, and so it's already in North America. So we can expect to see it here. The question is when, and that gets to the travel restrictions that the president announced over the long weekend, hopefully buying us some time to get people boosted and make other preparations.
The biggest question has been, and the biggest concern has been, will there ever be a mutation? Will there ever be a variant that is vaccine resistant? Is this one of them?
I think it's unlikely, Larry, that we'll see a variant of COVID-19 that is completely resistant against the vaccines we develop. And that's because, for the most part, most of the virus still looks the same. The question is, how effective is the immunity going to be? And there are degrees of effectiveness. It's not binary. It's either effective or not. That's why we measure it in terms of percentage effectiveness. We can expect the percent effectiveness to go down in light of Omicron. The question is how much. And in the meantime, folks should know that Pfizer and Moderna are already developing with their mRNA technology a vaccine that is targeted to Omicron. That will take between 3 and 5 months for us to see it available to folks at least. But that's already happening in case this does end up being a much lower effectiveness.
Just today, the CEO of Moderna made a statement that he doesn't see a scenario where the current vaccines are as effective against this new variant, even as they were against Delta variant. And the stock market reacted to that, and they dropped even more. Is that concerning to you?
It's concerning. It doesn't surprise me entirely, to be honest with you, because that's what scientists and epidemiologists have been saying for some time now. He may be hearing the same thing from his scientists or may have more information than most, which is probably why the market's reacting the way it is. But what I can tell you is that that was the expectation from the moment we heard about Omicron, given the number of mutations. So this is something we're already tracking, we're already preparing for. But until we have the specific results on effectiveness of the current vaccines, we won't know for sure how big of a problem this will be.
Why don't we have more information on how effective the vaccines are against this? Is it because of the rate of vaccination in South Africa?
Well, right now, the South African scientists really need to be credited here because they just discovered this last week. For the United States, we were celebrating Thanksgiving while they were, working hard to characterize this, and they let the entire world know as soon as it was discovered. So this is a brand new variant, probably only several weeks old in terms of its spread between human beings in South Africa. And so it's just very new. That's why we don't know enough about it. I can tell you the scientists are working 24/7, though, to figure it out. And I think between 10 to 14 days from now, we will have reliable information on how effective the antibodies from vaccinated people are against this virus. And we'll be able to take quick action, hopefully, right after that.
What are we are still dealing with the Delta variant, though, at this point. And I guess one of the concerns from health officials like yourself might be that could we be taking our eye off the Delta variant as we worry about this new variant?
It's a great question. And that's a concern that not only hospital leaders have across the country who are seeing increased admissions in many places, but scientists and public health officials as well, who say, listen, we're already dealing with another increase in cases across this country with the Delta variant, for which there's already fatigue and where we're already seeing increases. And so we do need to protect ourselves against Delta. And the best way to do that, especially in light of the CDC's actions yesterday, where they changed the recommendation from people may get boosters to people should get boosters, everybody over the age of 18, is that people should get boosted. Everybody who qualifies 6 months after Moderna and Pfizer and 2 months after Johnson & Johnson should get a booster. That is what the best thing you can do to protect yourself against Delta. And it's the best chance you've got to protect yourself from Omicron at this time.
I know New Jersey is doing well with vaccinations. You're talking about people getting booster shots. Many people haven't even got their first vaccine. And I'm sure as a medical professional, you look at that and are more than just a little bit concerned, but maybe even puzzled. Did you ever think we'd get to this point where a vaccine would become political?
I didn't. And it's really regrettable, Larry, because we're talking about protecting people's health and safety here. There isn't an agenda that public health officials have other than to keep you safe and keep you healthy. I understand that there are conflicts at many times between economic activity and growth and financial health and public health. But as we've seen this virus do, it destroys plans when you're not controlling it. And that includes plans to remain healthy and out of the hospital for a lot of people. So the recommendation on boosters is not a political one. It is one that is meant to protect you. I've gotten a booster. I've vaccinated my 5-year-old child. She just turned 6 over Thanksgiving, but her first shot was when she was 5. And so we really try to live by our recommendations, and it should not be political. It should be based on fact and evidence. And I think we're on the right side of this.
Wonderful. As always, thank you so much for your time. Dr. Shareef Elnahal, President and CEO of University Hospital in Newark. Still to come on Jersey Matters, Congressman Donald Payne talks about the billions that New Jersey is going to get from the federal infrastructure bill. That's next.